Hi, my name is Dr. McIntyre and I'm a pediatric hospitalist here at the Elliot. Our team specializes in caring for hospitalized children. The number one cause of pediatric hospitalization in the United States is bronchiolitis. Today, I'd like to share some information on bronchiolitis and what to expect if your child is admitted to the hospital. Bronchiolitis is viral inflammation of the small airways. It can be caused by many different viruses, one of which is RSV. If you picture a big oak tree and flip it upside down, the trunk is the main airway and the big branches are the bronchi. That's what gets inflamed when people, primarily adults, have bronchitis. Then the tiny limbs going out to the leaves, those are all the bronchioles going out to the air cells. In bronchiolitis, it's these tiny limbs that get inflamed and often blocked by mucus. When the small airway is blocked, air cannot get through to the air cells, and this can lead to decreased oxygen saturation and increased work of breathing. Children cough to try to clear the mucus, so cough is actually a really good thing in bronchiolitis. It's the body's way of trying to protect itself. This is one of the reasons why we do not recommend cough medicine in young children. Since this is the viral illness, there are no antibiotics for treatment. However, your doctor may recommend antibiotics if there is a concern for another bacterial infection at the same time. This could be something like an ear infection or pneumonia. The mainstays of treatment for bronchiolitis are what we call supportive care, such as effective suctioning and ensuring that children are staying nice and hydrated. This helps prevent the mucus from really getting concrete like cement and drying up, which makes it easier for us to suck it out. Supportive care also includes respiratory support, and we assess work of breathing to determine what type of respiratory support your child might need. There are 5 levels of work of breathing and also 5 levels of respiratory support. The lowest level of work of breathing is no work of breathing. This is when your child is doing well and they're nice and healthy. The next level of work of breathing is what we call minimal work of breathing. This is usually when they're breathing a little heavier than normal, maybe using their belly to breathe a little bit, but they're still safe to be at home. And then the 3rd, 4th, and 5th level are mild, moderate, and severe work of breathing. This is when a child is clearly in respiratory distress and having difficulty breathing, and they need to come into the hospital. We assess many things to determine the level of difficulty. We assess their overall mood. Are they still smiling? Are they still happy? Are they super duper tired and lethargic? We assess their vital signs too. We look to see if they're using their belly muscles to breathe, if their rib cage is sucking in and out, if they're having some tugging right here at the notch of their neck. We look to see if their nostrils are flaring in and out, if their head's dropping down, and if they're grunting every time they breathe out. Anytime one of these signs is present and happening at home, they definitely need to be evaluated for respiratory distress. Here, we use these levels to help guide what type of treatment and therapy your child might need. This helps us determine what level of respiratory support they need. So there's 5 levels of work of breathing and 5 levels of respiratory support. The lowest level of support is no support. Next is low flow oxygen. This is a nasal cannula, which looks like this. This little piece goes into your child's nose. And this is a nasal cannula that's hooked up to the wall and just provides oxygen. We like to keep oxygen numbers above 90% when a child is awake and above 88% when a child is sleeping. Little dips below 88% are okay, as long as the number comes back up shortly on its own. If a child is working hard to breathe, they may need more than just oxygen. So that brings us to the 3rd level of support. This level is called high-flow nasal cannula. This works by helping move air past the mucus and deliver it to the air cells. This can help decrease the work of breathing. The high-flow nasal cannula looks very similar to this, however, it's a little bigger and it's hooked up to a different machine. Sometimes the air cells are blocked by so much mucus that they end up collapsing. When they collapse, high flow does not have enough pressure to open them back up so that they can work again. If a child is working too hard to breathe and high flow is not helping, they often need support with pressure to help open up the air cells and allow them to work again. This brings us to the 4th level of support, which is known as pressure support. This is with either something called CPAP or BiPAP. CPAP is the most common type of pressure support, and it stands for continuous positive airway pressure. Many people have heard of CPAP because lots of adults use it at home for sleep apnea. However, in pediatrics, CPAP is considered what we call an intensive care intervention. Here at the Elliot, we do not have a pediatric intensive care unit. So, if a child needs CPAP for an extended period of time, we will transfer your child to a children's hospital that has a pediatric intensive care unit, also known as a PICU. The fifth and final level of respiratory support is endotracheal intubation, or endotracheal tube, also known as a breathing tube, or when your child is intubated. It is very rare for children with bronchiolitis to need this. However, it is important to know that it is always an option in cases of severe respiratory distress and respiratory failure. Throughout your child's stay here at the Elliot, our team will be assessing your child frequently and providing hydration and whatever respiratory support that your child needs. In order to go home, we'll be looking for 3 main discharge criteria. First, no respiratory support for at least 6 hours. Second, improved work of breathing. We want your child to look much better than when they came into the hospital. And then third, improved hydration. Your child has to be drinking enough fluid to stay hydrated. We don't worry about them eating food too much, but fluids are really important to stay hydrated at home. Our team will be available to answer any questions throughout your stay, and we look forward to taking care of your child and family. Thank you for trusting us with the care of your child.